Hi, this is Peter Grading, and I am the project leader for the firefighters team for OMSCS 6440, the Intro to Health Informatics course.
Howdy, howdy. This is Tony Potter. I'm one of the programmers for our team's 6440 Intro to Health Informatics program.
And joining our team this semester are Shashindra Pradhan, Ali Sheikh, and Radha Venkataraman, and you'll be hearing from them in other presentations this semester. Today we're going to talk to you about our project topic, which is a fire interface to link to death data for the Utah Department of Health. Our primary mentors for this project are Jeff Duncan at the Utah Department of Health and Paula Brown, who's at the U.S. Centers for Disease Control. Paula is really facilitating for Jeff for quite a few projects for our course this semester. So if this topic seems kind of familiar to you, you've probably seen one of the other projects. There's a couple of user or business requirements for this project that we'd like to review. The primary business requirement is providing a notification to Utah Medicare, which is called the Division of Medicare and Healthcare Financing, about the death of a provider. DMHF has discovered through audits that they are paying out claims on prescriptions for controlled substances for providers that have died. So by providing these notifications, that's going to allow them to deny those claims and save money. A secondary application of this project, which could be an extension, is providing death notifications across Utah healthcare enterprises over a health information exchange. This would be really useful when you're dealing with federated data and a patient doesn't necessarily die in their home health system. And then on the other end of the spectrum, this could also be used to send birth notifications, which is something that Utah is really interested in working on, and they call it cross-community patient discovery.
So when a provider dies, the death event is going to be registered in EDEN. That's the Electronic Death Entry Network. And the death event is going to be pushed to DOH MPI. That's the Department of Health Master Person Index. And it's going to be linking a death certificate to the provider in the Directory of Clinicians. Our job is going to be taking that provider info and transmitting it to DMHF via Fire Interface.
We've identified a couple areas of research that we need to familiarize ourselves with. Under infrastructure, the key item that we need to know about is utilizing PostgreSQL, which is what the current system, the Directory of Clinicians, is implemented in. Finally, we've got to have some basic understanding of FHIR, which we've been learning in this course, and utilizing and calling web services. Once we've determined what tech stack we're going to use, we're going to need to make sure everyone is familiar with that or can familiarize themselves with it. On the conceptual side, we've got to understand how to create appropriate synthetic data for our testing purposes, make sure that we understand the process workflow for all these interconnected systems, understand utilizing REST APIs because that's how we're going to principally transmit all of this stuff, and really understand that we're doing a rapid prototype here. And finally, things we don't really need to focus on are a master patient or master person index. The Department of Health already has one. And production data is something that we asked about, but the amount of time it would take to get using that cleared would be after we finish this semester. So we're just going to use test data when we're working on this project.
We're going to be transmitting death notifications using FHIR as our primary interface. We have to develop a proof of concept working with the existing systems for the state of Utah. And the Department of Health for the state of Utah is actually using this as a segue to implement FHIR and to get comfortable with using the FHIR interface in their systems. We're using the current Directory of Clinicians systems and using their PostgreSQL database to deal with all of this information. And the timing, we have to deal with a scheduled job. The death events are being entered on 9 to 5 during the day, so a nightly task would take care of this best.
So this is just a quick chart showing our project schedule to date. As you can see, it's not really fleshed out yet. That's because we're waiting for some more technical details to understand what our next tasks may be. But in the next 2 weeks, we've got some tasks for everybody, which includes playing with the ClinFire website, which is like a FHIR sandbox, and looking at some of the libraries and APIs that are out there for implementing FHIR to help us drive what programming language we're going to choose. And so that's where we are with our topic and our project so far. We're looking forward to seeing you the rest of the semester.
Thanks a lot for watching. We'll see you next time.